How's it going, guys? We have a medium difficulty question for Immuno Step 1, Pediatrics 2CK. The latter, they expect you to know immunomechanisms like this at a Step 1-esque level. Some of you will think this is too easy. Relax, okay? So 3-month-old boy, recurrent sinus pulmonary infection since birth. Physical exam shows diffuse hypopigmentation. Peripheral blood smear shows giant granules within neutrophils, which the following most likely explanation for the patient's findings. Choice A, deficiency of CD18 LFA1 integrin. Wrong fucking answer. Refers to leukocyte adhesion deficiency, which will present one of two ways in USMLE. So many of you watching this will know the very buzzy, delayed separation of umbilical cord at birth, which you can't rely on that as a crutch because the other 50% of questions, they won't mention that. They're going to say there's absent neutrophils at the site of infection, or there's absent neutrophils in the skin, or there's absent pus at the site of infection. Because we have deficiency of the integrin here, the leukocytes cannot diapedese. They cannot leave the vasculature. Wrong fucking answer. Choice B, failure double-stranded DNA repair. Wrong fucking answer. So could refer to a myriad of things, but ataxia telangiectasia under the envelope of immunologic disorders. So 100% of questions, they're going to be extremely easy with the diagnosis. Okay, they'll hand it to you. They'll say, 3-year-old boy, he's got ataxia and telangiectasia. Holy shit. And then they'll say which the following most likely explanation for the patient's findings, and the answer is just failure double-stranded DNA repair. In this case, wrong fucking answer. Choice C, impaired phagolysosomal fusion. Correct answer. Diagnosis, Chigai-Kagashi syndrome, which is LYST gene mutation leading to impaired ability of phagosomes and lysosomes to fuse, where these organelles can accumulate within the cytoplasm of phagocytes, leading to giant granules, very buzzy descriptor. And melanosomes also require phagosome fusion, so they accumulate within the cell and you can get partial albinism. So basically 100% of questions are going to present like this for Chigai-Kagashi. When you have quote-unquote weird / obscure conditions, USMLE will always give them to you very buzzy with how they describe them. Giant granules, okay, partial albinism, and then the answer is just impaired phagolysosomal fusion. Let's just hop through. Final answer choices: IL-2 receptor deficiency. Wrong fucking answer. So this is SCID, severe combined immunodeficiency syndrome. So IL-2 receptor deficiency, common gamma chain mutation. Those are X-linked recessive SCID. Adenosine deaminase deficiency is going to be autosomal recessive SCID. It's going to be B and T cell deficiency. So you're going to get viral, fungal, protozoal, and bacterial infections since birth. Okay, fungal, viral, protozoal, or T cell problems that will lead to those infections. Bacterial, it's going to be B cell problems. You're going to get absent thymic shadow, that's your T cell deficiency. You're going to get scanty absent lymph nodes tonsils, that's your B cell deficiency. Wrong fucking answer. Choice C, tyrosine kinase abnormality. Wrong fucking answer. Refers to Bruton X-linked gamma globulinemia. So Bruton tyrosine kinase is either deficient or absent or abnormal in this condition. It's a B cell only deficiency. They won't mention absent thymic shadow. They're going to mention in a boy, because it's X-linked clearly, that there is scanty absent lymph node tonsillar tissue. And I'd say about 4 out of 5 questions, they'll mention bacterial-only infections occurring from about 6 months of age. Okay, so it can be 5 months, can be 7 months. There's an audacious question floating around in one of the 2CK forms for peds where they say a boy has bacterial infections only since birth. And you're like, holy shit, like they said since birth though. I mean, that sounds like SCID, but they tell you that there's absent lymph node tonsillar tissue and they only give you bacterial infections, no other types of infections, and you're able to eliminate to get there. So I'm just saying, most of the time we have this buzzy descriptor from 6 months of age. So wrong fucking answer. You know the deal. I'm just going to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.